Hi, good afternoon, everyone. Thank you so much for being patient and waiting for this pitch session right now. My name is Siddharth. I work in the physiotherapy space. I'm sure all of you would have experienced either directly or indirectly the process of physiotherapy and how it is ultimately delivered to patients. Typically, what happens is patients meet a surgeon or a physiotherapist, and then they are trained on different protocols that they're required to undergo to improve their condition, and after a few sessions they're required to complete this physiotherapy or continue this physiotherapy for a longer duration at home. At this stage of the physiotherapy journey, a lot of compliance issues come into picture, a lot of negligence is happening from patients. Patients are not doing these exercises. If they're doing them, they're making mistakes, and hence the recovery or the outcome for the patient is not as great as it could have been. Also, for various logistics challenges, affordability reasons, a lot of patient drop-off is also seen during this entire chain. So what me and my co-founder, so my co-founder is Dr. Ashish Babhulkar. He's the head of shoulder surgery at Dinanath Mangeshkar Hospital. It's a large 750-bed hospital in Pune. The two of us came together 3 years back, and we've developed a platform which will enable clinicians, both surgeons, physios, to deliver better quality physiotherapy to their patients and monitor them, especially when they're required to do it from the comfort of their home, alone at home, without the presence of an in-person physiotherapist. So what happens is, we've built a computer vision-based virtual physiotherapy assistant. Imagine you're standing in front of your phone camera and exercising. It is going to track you, it is going to guide you, it's going to measure your movement, range of movement, the number of repetitions that you've done, and it will guide you very much like a virtual physiotherapist. All of these reports are then sent back to the clinician for them to monitor remotely. We also do 2 assessments, range of movement and pain. We currently are not able to measure strength in a remote environment, but a good reference of how the patient is progressing on range of movement, specific angles or specific movements that the patient needs to improve on, as well as specific VAS scales. So your Tegner Lyshom index for the knee, shoulder pain and disability index for the shoulder, and so on and so forth for different joints. We are able to track them and also send them back to the clinician. I want to show a video. I don't know how it's connected here.
You struggle to track your patient's physiotherapy rehab? Are your patients not complying with the physiotherapy programs prescribed by you? Presenting to you WIZIO, our revolutionary platform, helps you manage your patient's physio digitally through a simple mobile application. Based on your patient's requirement, add a physiotherapy module in their name. Customize the exercises from our library of exercises if necessary. Once your patient accesses this curated program through the WIZIO app, they will get complete guidance through videos, reports, and blogs for each exercise. And it doesn't end there. Our app uses cutting-edge artificial intelligence to track the patient's movement and posture. Track your patient's attendance, consistency, and errors remotely through standardized pain and range of movement assessments. Monitor their adherence and daily performance with assessments to track the range of movement and pain. With some of the best surgeons and physios using the WIZIO platform, our condition-specific programs, guided by AI, are revolutionizing home rehab for patients and clinicians. Join the WIZIO platform to help your patients recover better and faster through AI-enabled physio.
So what is our vision now? So we've already covered a lot of ground in the musculoskeletal space. Now we are building an extension of the product where patients can experience this in a better way by in front of a larger system which can be established or implemented inside a physiotherapy clinic or a department. So what you're seeing on the left is basically an in-clinic device that physiotherapists can set up inside their clinic. Along with that, we are also now gradually moving towards neuro-physiotherapy. Again, a combination of motion-based exercises along with cognition-based exercises. And this entire journey of the patient, both in the form of exercise or assessments that you do in a clinic and what you do once you go back home, that entire patient journey, both in the form of performance of exercises as well as assessments, is now available to the patient to track, as well as to the clinician who is undertaking that patient. So that's how we see this growing further. We are more than happy to partner with as many of you as possible. We are very closely connected to the healthcare ecosystem. Our customers are basically many of the people sitting in this audience right now, clinicians, hospitals, private practitioners. That's whom we sell our products to, who eventually then recommend this, refer this to their patients. Yeah, that's it from my side. Thank you so much for being such a patient audience.